Mr. Speaker, at a time when vital issues like the health of women and children in our province should be our focus, we're being distracted by this burlesque sideshow. Burlesque dancing is but an example of one of the many cultural expressions in our province, and it shouldn't be targeted inappropriately by cabinet ministers. It's troubling how this NDP government has failed to stand up and support Osborne House, failing to increase its funding when needed, and insulting the very support services badly needed by the vulnerable women and children trying to escape domestic violence in Manitoba. Will the Premier guarantee that his government will not turn its back on the women who need the services of Osborne House by pulling away funding as a result of this issue?
Mr. Speaker, we continue to advance issues of protecting women who are the victims of violence. I recently was at an event where for the first time ever we enlisted the support of the Winnipeg Blue Bombers on sending very clear messages that domestic violence is unacceptable. And some of the people that were stepping forward to do that had seen that, had those experiences in their own lives, and now we're standing forward as leaders in the community to do that. We provide significant funding to our domestic shelters in Manitoba, and we'll continue to do that. I only need to remind members opposite that they wanted to cut all those programs this year. That was their proposal. Indiscriminate, across-the-board cuts, tough love, and a chill on public services. They would have cut domestic violence services in Manitoba. They would have reduced those services. They would have put people on layoff. That's not the approach we chose, Mr. Speaker. We chose to protect those services.
Mr. Speaker, continuing on women and children's health in Manitoba, there are many reasons for concern, but one of these is the government's own report, which says with respect to First Nations people in Manitoba that vitamin D levels in most pregnant women and their infants are in the deficient or insufficient range. Dr. Bob Schroth reports 80% of the pregnant women in inner-city Winnipeg have low vitamin D levels. Not only is vitamin D badly needed for healthy bones and teeth, low levels of vitamin D may lead to the development of type 1 insulin-dependent diabetes. I ask the Premier, will he admit that this is a problem, and will he commit to the coordinated all-party approach to delivering a solution to this as soon as possible?
Thank the member for the question. This is a question he raised with us last week. He does know that in Manitoba, we invest up to $400 million for children in the preschool phase of their life. And one of the things we do is we provide prenatal benefits to women in Manitoba who are going in the process of having a child. We have home visits to go out and visit them frequently, public health nurses that do that. We have family resource centers, of which we've invested significant millions of dollars to create safe spaces in communities where young parents can come and learn the skills of parenting and to be able to support each other as they go through that important part of their roles in life. And Mr. Speaker, we are very committed to that. That includes nutrition, that includes proper nutrition, including vitamin D, and we're very interested in finding ways to ensure that people have the nutrients they need to support healthy children and to support themselves, Mr. Speaker.
Mr. Speaker, the Premier is doing a lot of things, but they're missing a target because the deficiencies are still there and extremely high proportion. Mr. Speaker, at a hearing of the Healthy Kids Task Force in 2005, Lisa Kaler described children whose teeth hurt so badly that they could hardly eat. It was evident from stories like these that we need to do far better than what the 2005 task force proposed. Indeed, in the 8 years since, efforts have had little impact, with no improvement in the rates of early childhood tooth decay. We now need a commitment to eliminate nutritional deficiencies in Manitoba as soon as possible, and with an effective plan to do this. Are the Premier and his ministers ready to participate in an all-party coordinated effort to do this, because his effort to date has failed?
Mr. Speaker, the member opposite has voted against every additional resource we've tried to provide to Manitobans for healthy foods. We had about a handful of community gardens in northern Manitoba a decade ago. Mr. Speaker, we have up close to over 900. I hear the minister responsible saying close to 1,000 now. These are gardens that provide nutritious vegetables to people in their communities. They're growing those vegetables, they're doing it together, they're developing their sense of neighborhood, they're learning about healthy foods. These are very important investments. We were the lead donor to the Winnipeg Foundation, who has set up a permanent fund called Nourishing Potential. That fund has invested at least $400,000 to date on a variety of food security programs all across Manitoba. Breakfast programs for children, community gardening projects, a variety of innovations connected to what people in their local communities and schools and neighborhoods think will make a difference for their people. We just announced last week up at Norwest Health Clinic a program to help people learn the skills of healthy cooking and how to do that together and how to provide proper nutrition to themselves. We're very interested in food security. It's one of the planks of our poverty reduction strategy, Mr. Speaker, and I invite
Order, please.
members
The
to
First
support
Minister's time has expired.